Community Technical Assistance Center, and I would like to welcome you to today's offering, Applying MI to Support the Adjustment-Related Needs of Caregivers of LGBTQIA+ Youth. This is a follow-up to our two-part series using motivational interviewing to support LGBTQ+ youth and their caregivers. If you missed part 1, which focused on applying MI tools to support the coming out process of LGBTQ+ youth, you can access the recording on our webpage at www.ctacny.org. Before we get started, I want to take a moment to orient you to the WebEx system so you know how to participate in today's event. Please note that upon joining the webinar, you have been placed on mute to avoid any background noises that may distract others from listening to the presentation. If you come across any technical issues during today's event, please chat to the host who will be able to assist you. For optimal viewing, you can go to the top right of your screen and click on Layout and select Side by Side. You will also have the opportunity to communicate with the presenters by utilizing the chat box feature, which is located on the right-hand side of your screen. Please address your entry to all panelists. However, if the chat box feature is not visible, click the dialog bubble on the toolbar at the bottom of your screen and it should appear. You will also have the opportunity to submit questions for the Q&A portion at the end of the presentation. In order to ensure that we are able to answer as many questions as time permits, we are requesting that you send your questions at any point during the webinar using the same chat box feature and address to all panelists. We are very excited to have with us today Dr. Rachel M. O'Neill and Dr. Brandy L. Gilia for today's topic, focusing more so on caregivers. Once again, thank you for joining us. I'm now going to turn it over to our presenters to introduce themselves and to get us started.
Thank you, Diana. We appreciate it. Hi, everyone. I'm Brandy Gilia. Thank you so much for the opportunity to be here with all of you today to have a discussion about such an important topic. A little bit about me. I am in Ohio, so I would love to hopefully travel again, maybe visit New York, but for now, I'm in Ohio. I am a core faculty member at Walden University. We are a digital online mental health counseling program, and I primarily teach ethics and legal issues. I'm their subject matter expert in that area. I realize that not everyone has the same passion for learning about ethics and legal issues, but find it a little fun to explore the gray. Also very passionate about the topic that we are talking about here today. In addition to my role as a faculty member, I am a clinical manager with Talkspace. Talkspace is a digital platform for delivery of mental health services, and I am primarily responsible there for our full-time clinicians and the delivery and overview and oversight of their services in that program. So a few different things, which is like how I like to spend my time, doing a bunch of everything. I also have 2 little ones, a 7 and a 4-year-old to keep me busy, and a husband as well. So really appreciative of the opportunity to be here today. I will toss it over to Rachel for an intro, and then we will go ahead and get started with the content.
Thanks, Brandy, and thank you to Diana and the team for giving us the opportunity to be here today and talk about this important topic. I'm Rachel O'Neill, and part of the reason I like to go second when Brandy does the introduction is because it's just very easy to sort of say ditto to Brandy's introduction. I am also a full-time faculty member at Walden University. I primarily teach diagnosis courses, and I'm the subject matter expert for diagnosis for our counseling department. I am the director of clinical effectiveness for Talkspace as well. So Brandy and I have been together since our doctoral program, actually our master's program, and our careers have sort of continued to parallel each other as well. I'm really excited to be here and to talk about this topic. It is a topic that I'm incredibly passionate about. My area of expertise is working with individuals in the LGBTQIA+ community, particularly youth and their families. So when Brandy and I co-authored this article, it really came out of clinical experiences that I had supporting both youth as well as their caregivers in navigating the coming out process. So incredibly excited to be here and have the opportunity to present on this topic and to talk about ways that in your own clinical practice you may be able to utilize some strategies in motivational interviewing to begin to assist with this difficult topic. So I'm going to toss it over to Brandy, and she is going to just walk us through the objectives of our presentation today.
Thank you, Rachel. So we will provide a brief overview of some of those basic tenets of motivational interviewing. We're well aware that you already had an opportunity to talk more about that area in part 1 of this series, but perhaps a bit of a refresher will be helpful as well. This refresher will be specific to therapeutic application of caregivers of LGBTQIA+ youth. We're hopeful that by the end of the presentation today, you'll learn a bit more about the importance of caregiver support and the coming out process for our youth. We're mindful of the fact that this audience largely understands the importance of the support of caregivers in the coming out process. We're also very aware that not all of the youth that we work with or clients or individuals that we work with get that positive supportive response. So of course, a lot of what we talk about today will be how to work with caregivers and helping them to become more supportive in that process. And then we'll talk about the therapeutic possibilities of motivational interviewing to help resolve caregiver ambivalence and increase opportunities for appropriate supportive caregiver responses for LGBTQIA+ youth. But before we talk more about that, we have the opportunity to have a bit of fun. So Rachel is going to facilitate a chat-in question for us. It's always great when we have audience participation. It adds an amazing dynamic, and we're well aware that all of you have a ton of knowledge and experience that you can bring to the discussion today. So we will, of course, be attentive to questions, and we are excited for you to participate as well. So Rachel, if you want to go ahead and facilitate that.
It would help if I was not on mute. Thank you, Brandy. So we would like you to just spend a moment reflecting on this briefing yet. And if you're inclined to do so, we would love to have some participation here and have you just type in the chat box 1 or 2 things you may say if you were working with Ralph and Ralph shared this with you. And so what it says is that Ralph, who is a 39-year-old cisgender man, states the following. He says that yesterday, Jessica, my 12-year-old daughter, said she identifies as something called non-binary and that she wants to use the pronouns they, them, and asked me to call her Jay. This is all a bunch of nonsense that she picked up on TikTok or Facebook or something, but whatever it is, she's a girl, and that's as far as that as I'm concerned. So please go ahead and take maybe just 1 or 2 minutes to think about what you may say to Ralph if you were working with him in a professional context. So if you were Ralph's social worker, therapist, counselor, mental health professional, caseworker, what would be something that you may say to Ralph if he shared this information with you? And we'll just take, again, maybe 1 or 2 minutes here for you all to share your thoughts. I'm just going to call out some that are coming in. One was that, how do you feel about what she said? Has she said something like this before? Which I think is a really good way to begin to open the conversation. Another one here is, that seems like a lot to take in. Can you tell me more about how you're feeling about this? That's a great open invitation to begin the conversation. We'll talk about some of those open-ended questions in a little bit, but it's a great way to begin to facilitate discussion. And as we'll talk about later on, it's a great way to roll with the resistance. So you're not directly trying to change Ralph's mind right now. You're opening a lot of conversation at this point. Let's see some others. So somebody mentioned asking, do you know what non-binary means? That can be a really great starting point as well to provide some psychoeducation. Motivational interviewing uses a great deal of psychoeducation. Another one here. There's so many coming in. This is so great. I love the participation. It makes me wish we were all in the same room so I could hear you sharing these out loud. Jessica said it's sometimes confusing when your child says things like this. Do you know what those terms mean? So great, another opportunity to provide education. Someone shared that's a lot to process. I imagine it was difficult to hear. Great validation of emotions. Would likely open the door to additional conversations as well. Another one, this sounds like a huge change for family. Have you handled major changes in the family before? I love that. It's a great solution-focused question. It's a great opportunity to begin to help Ralph see, have there been moments in the past that have felt pretty overwhelming, and maybe how did Ralph deal with those situations? I like another one here that your daughter shared her feelings with you. I think that's a great introduction point to begin to maybe underscore the strength of their relationship, that that Jay was willing to come forward and share this information. How do you feel that your relationship would be impacted if this topic is not further discussed? So a good continuation, talk later about discrepancies, but a great way to highlight the discrepancies of the idea that Jay felt comfortable enough to bring to their father's attention these feelings, and if Ralph is not receptive to how Jay's feeling, that relationship could be impacted moving forward. I'm just going to read a couple more. These are all so good. I am so excited about this participation. That must have been really surprising for you. It sounds like you have some knowledge about this topic from social media. What else do you know about the community outside of those platforms? Another great example of a way to begin to open up conversation, and a way to kind of assess where Ralph is in his understanding. He seems to know that perhaps there could be some supportive social media spaces, and perhaps Jay is even utilizing some of those. It's not uncommon in those of you that work with caregivers of LGBTQIA+ youth know that oftentimes one of the initial narratives is that they believe their child has like learned this from somewhere. So they believe like someone is putting ideas in their child's head. So it's a pretty common narrative, but it could be helpful to what is his understanding, what is Ralph's understanding outside of those platforms with regard to the community. Let's see, I'm just going to do one more. There's so many good ones. Ralph, I totally understand how you feel. My spouse and I went through this as a parent of a transgender child. Would you like me to share our experience? So a great way to use a self-involving statement, and a great way to build that empathy and that connection. If Ralph was in a position where he may want to hear that type of experience, that could be incredibly helpful. This is great. I'm so excited for this participation, and we will have some additional opportunities later on to also continue to participate in the conversation. So please keep this participation coming. Absolutely appreciate that. And we'll also have additional opportunities to discuss ways in which you'll begin to have these conversations utilizing MI with caregivers of LGBTQIA+ youth. So I'm going to toss it over to Brandy now, and she will begin to share with you a bit of an overview of the need for these supportive responses, and then she'll move into talking about risks of low caregiver support when youth make the decision to begin the coming out process.
Thank you, Rachel. I am so energized by this group and their level of activity. It's amazing. I would love to be there with all of you, but it's great seeing you in the chat as well. So a bit of contextual information as we move forward here today. LGBTQIA youth and their caregivers often describe the coming out as a process that impacts the entire family unit. So each individual has their thoughts, feelings, their experiences as the information is provided to the family, as well as the youth who is sharing their coming out to the individuals as well. We know that caregivers may experience a wide range of emotions in response to the youth coming out. It's even possible that some family members might not be prepared to provide the support to their child that's required or that's needed as this youth is going through the coming out process. Or they may even be unsure of how to appropriately support their child. This becomes a very pivotal point for a counselor or a mental health professional or social worker to become involved in the process to help the entire family unit that includes the youth as well as the caregivers, as well as other important and meaningful people in their life. Caregivers of LGBTQIA+ youth who do seek counseling may really benefit from collaborative treatment that addresses the ambivalence to the coming out process. Through the chat-in, we heard a lot of different suggestions that opened an opportunity for more conversation, that provided an opportunity for the mental health professional to align beside the individual that's coming to them for help, to establish trust, to establish rapport, and then to move forward into a process as we move into motivational interviewing that we'll address more directly, that really does hone in on the ambivalence that is being presented in as part of that experience. Therefore, we know that MI is a piece that we can use and is an important element and intervention or approach to use throughout this process. There truly is a risk of low caregiver support throughout this process. Vulnerable people, vulnerable populations, including LGBTQIA plus youth, are really particularly in need of a strong social support because they're likely to face daily injustices. We know that when youth do decide to come out to their families, the family members may experience ambivalence. I mentioned this, ambivalence specific to all of the conflicting emotions that they're experiencing, perhaps thoughts of what they thought life was like, what they thought their child was like, who they thought their child was, what it's like to be supportive to their child, to understand their child, to align with their child, to support their child. So truly focusing in on this ambivalence regarding their children's identity, particularly when they don't align with the preconceived heteronormative and cisnormative expectations. So especially when that individual isn't identifying with their biological gender and is presenting themselves in alignment with LGBTQIA plus identities. So when a parent has a very traditional view of gender identity, traditional view of a lifestyle, we start to see a very much of a need to address that ambivalence that's being experienced. That overt sorry, Rachel, I was still rambling on that slide. Overt non-acceptance of a youth or any type of family inflicted consequence for that coming out process or for the LGBTQIA plus individual, things such as verbal or physical assault, limiting access for supportive resources, trying to hide one's identity. There are stress factors related to religious persecution or judgment, blame, and the use of shame. These are all themes that we hear often when there isn't a supportive environment or a supportive relationship or caregiver as part of this process. Rachel, we could go ahead and move forward. Thank you. So when there is an actual rejection or even a perceived rejection, because perception is such an important variable as well, perception of how others are responding and how caregivers are responding to the youth through the coming out process. Really, so when there is a perceived rejection, when there is a non-supportive environment, we see an increased likelihood of risky behaviors. So some examples might be drug abuse, unprotected sex, increase for depression, increase for suicidality. Sorry, I want to get that word out. But truly, when we see a non-supportive environment, again, there's a correlation to high risk or higher risk situations. When there's family rejection or caregiver rejection, we also see increases in self-harming behavior, specifically, as well as so when we compare this population, the LGBTQIA plus population, to that of their heterosexual cisgender peers, that's where we start to see elevation in these areas. So we start to see these higher risk situations. It's very likely as well that an individual may present with some of these factors initially in counseling if it is the youth that's presenting, or if it's the caregiver that's presenting. We may hear more of this first before we are privileged to learn more about the individual or hear more about their story and their experiences. So I think we know it's very clear that family and acceptance and family support can serve as a protective factor in regard to many of these risks. Specifically, MI, motivational interviewing for family members, is an important first step when working with LGBTQIA youth and their caregivers. So more risk associated with their support, when there is that fear of non-acceptance, it's truly a major reason why the LGBTQIA plus youth might not disclose their sexual or gender identity. They are fearful of how others will react. They are fearful that they won't be supported. They are fearful that there will be another level of pain or hurt or anxiety added to the feelings and experiences that they already have. therefore silencing the individual or leading them to adopt perhaps unhealthy coping skills or engage in those risky behaviors, or choose not to share or involve people in their coming out process that they might truly want to be part of that. Individuals and youth do tend to disclose their sexual orientation or their gender identity to those that they feel safer doing so with first. So perhaps with siblings, with friends, or with other trusted authority figures before disclosing to their parents or their caregivers. So to be mindful of the fact that other people may be privileged to this information first and be able to be part of this process before caregivers are overtly made aware or are able to be part of the process. Why? Because of this fear of their family's negative reactions. This is why a lot of youth choose other people to go to first. They are choosing those individuals whom they have a higher level of trust with, who they feel safer with, who they feel are more likely to have a positive response to them. So there are less ramifications involved if it's their friends. If their friends are not accepting, their friends aren't perhaps, they're able to accept that more if it's their friends, as opposed to those individuals that they have learned to turn to for support, whose opinions matter to them. Of course, friends' opinions matter as well, but that caregiver role holding such a pivotal place or important piece or component here in that youth relationship. When youth do come out the family, the process could result in a strain in the relationship as well between the LGBTQIA+ youth and their family members. Again, this is a place where MI is very helpful in the work with caregivers and specific to addressing the ambivalence. Rachel, go ahead and move forward. So this potential for a loss of social support and the fear of what might happen if they lose social support truly is a realistic consequence for individual youth, for LGBTQIA+ youth in the coming out process. It is very realistic concern that there may not be social support. There is a very realistic concern that caregivers and family may not respond in a way that is helpful or encouraging or positive. It is very likely that those fears are going to be reinforced, or those anxieties that they had might be reinforced. So like some additional elements of this are that the inability to be able to openly speak about one's sexuality, about their gender identity to friends and family might even further decrease their social support. So there's a further level of isolation, a further level of separation from other individuals or loved ones in their life. So coming out may not necessarily result in increased social support. Oftentimes we do see that opposite happen. Situations that do result in the adolescent feeling rejected by their family or rejected by their caregivers might interfere with their ability to use positive or learned coping skills that they already have in place. And so other mental health issues may be aggravated. So if you think back to a few slides ago, I shared that an individual might present with depression, might present with suicidality, might present with self-harm, or perhaps they already are struggling with the criteria or with elements of a mental health issue. And then that lack of support or the fear or anxiety related to responses to their sexual identity or gender identity may complicate that as well. So we know that this decision, the decision to come out to parents and caregivers, does hold a lot of risks, and it really does or may require an affirmative counseling approach for both the LGBTQI+ youth as well as their caregivers. I thought I saw a question pop up in the chat, so I'm gonna try to take a peek. Is there any research on generally how long it takes to use MI in order to see change talk from ambivalent parents? This is a great question, Abby. We will talk even more. I believe Rachel will talk even more about motivational interviewing specific to the work with caregivers. Length of time is dependent on so many variables. Specifically, motivational interviewing being very highly correlated with one stage of change or readiness to change. So those individuals, those caregivers who already present to us and what we know is an active stage of change, a readiness to accept and to acknowledge the ambivalence, a readiness to begin doing the work, we're likely to see a faster response, a more likely to hear that change talk, more likely to see a decrease in ambivalence than those who present to us an earlier stage of change. So perhaps are contemplative, who are acknowledging that there's a strain, that there is a non-supportive environment, that there is not an understanding, but they are very much still in that piece of, if we go back to the example of Ralph, they're very much still in that piece of, this is just something that was picked up on TikTok or Facebook. And so we still see a strong level of non-acceptance present. So working with and meeting somebody with where they're at in terms of their stage of change as we move forward. But I know Rachel will have more to say about this as well. So thank you for the question.
Yeah, it's a good transition. I didn't cut you off again, did I, Brandy?
No, you're good. I was actually like, is this my slide? It's always
Okay. Great transition. So let's talk a little bit about benefits of caregiver support. Brandy just talked about all the risks, and she talked about all the reasons why it's important for youth to feel supported. But beyond the risks, there are benefits too, and there are benefits to LGBTQIA plus youth having caregiver support. We know that positive protective factors are associated with a supportive caregiver response. So that when a youth makes a decision to come out to their caregivers, if they're met with a supportive response from those caregivers, it generally tends to serve a protective factor that can be seen in a number of different ways. Um, Probably the most prominent way, and perhaps the most important way, is that a supportive coming out experience, and in particular a supportive coming out experience from caregivers, is associated with a reduced risk of suicide attempts. Now, we know that individuals, youth in particular, in the LGBTQIA plus community are at an increased risk of suicidal ideation and suicide attempts. And so anything we can do to mitigate this risk is incredibly important. That caregiver response is so critical at this particular moment in time. It's so critical for that individual, especially at the point of coming out, to feel that their caregiver is providing a supportive response and to not feel rejection. So instead of feeling rejection, to feel support. Beyond mitigating the risk of suicide, it also serves as a protective factor for other risk factors as well. So things like a lower risk of substance use, depression, suicidal self-injurious thoughts. That supportive caregiver response is associated with overall a greater sense of resiliency, a greater self-acceptance, and a greater sense of hope and optimism for the future as well, which I'll talk about more here in a moment. On the topic of hope, optimism, we know that individuals who have that parental support are more likely to experience resiliency, and as a result may have better long-term adjustment than individuals who don't have it. And this is true, this is important, but this is true not just for individuals in the LGBTQIA plus community. So youth in general who have parental support and who feel optimism experience better long-term adjustment. In general, again, family support is correlated with more favorable achievement outcomes across the lifespan in places like education, employment, and self-acceptance. So while we're speaking today about the importance here for LGBTQIA plus youth, these components are important for youth in general. And so the topics we're discussing truly are applicable anytime a parent is experiencing a situation and where they're not aligned with their child, or where they may be at risk for rejection or perceived rejection of their child. High levels of communication pre-disclosure can serve as a protective factor in relationships. We saw this conversation in the chat where folks were pointing out that Jay and their father seemed to have effective communication pre-disclosure because Jay chose to tell their father about their identity as a non-binary individual. That can be a protective factor as well, especially when we work with a caregiver. So as we'll see later, in our case example, it may make a difference in terms of how the caregiver comes to learn of their child's identity. So whether the child comes out to them or whether the child, it's an inadvertent disclosure, like the parent stumbles upon information, that can be important in terms of how we decide to treat the caregiver. But those high levels of communication, trust, and conversation before the coming out process can certainly serve a protective factor moving forward as well. And family members are likely to be more supportive of the youth if they have positive relationships with members of the LGBTQIA plus community, if they've had exposure, if they have awareness of the community. So again, for some families who are struggling, typically their experiences with other individuals in the LGBTQIA plus community could be limited. Perhaps they're not aware of any other individuals. And what you'll hear from family members often is, I want life to be easy for my child. And there's that perception that somehow being a member of the LGBTQIA plus community may make life harder. So the more experiences that the parent has with other individuals in the community, the more likely they are to have a better sense of how to support their child through the coming out process. Additional benefits include, again, knowing that support of friends and relatives is incredibly important. Acceptance is important by friends and relatives, but it certainly cannot make up for the importance of a supportive caregiver response. The risk for exacerbation of mental health concerns is still present in LGBTQIA plus youth when they report non-acceptance outside of the house, even when they have high levels of social support within the family. So again, that caregiver support is of extreme importance here as we talk about ways for the parental support or the caregiver support to really act as a mitigating factor from some of those other forms of rejection or harassment or bullying or isolation that the child may experience, especially if they're among the most vulnerable populations, like individuals who identify as transgender and who are often subject to increased harassment or ridicule, or in some cases even threats to their physical safety because of their identity. I'm going to toss it back over to Brandy now, who is going to speak to the process of caregiver exploration. So we'll be sort of transitioning now from talking about globally speaking overarching themes about caregiver support and the importance of it to now really beginning to transition to talking about what this means when you're working with family members of LGBTQIA plus youth.
Thank you, Rachel. So more specifically, what is the impact? The impact emotionally to family members, the impact to caregivers. We know from what we've already talked about that initial impact of a caregiver learning that their loved one identifies as LGBTQIA can result in an emotional reaction. The emotional reaction, the emotional reaction that is evoked certainly has an impact on the youth as well as their coming out process. In the most ideal circumstances, the reaction is positive, the reaction is supportive, the reaction is happiness, right? That would be an ideal situation. But we all know that the ideal isn't always the norm of what happens. So depending on the welcoming or non-welcoming climate of the particular family member, and then as well as the region or community with which they live, some caregivers may experience even fear for themselves or fear for their adolescent safety. So for example, those who already live in a region or community or area with a very strong support system for LGBTQIA plus youth or adults might naturally already experience or feel more supportive, experience or feel less fear, less anxiety, as opposed to individuals who are living in regions or a part of communities where there's strong judgment, where there's a lack of advocacy, where there's a lack of understanding, where there are preconceived thoughts or notions, where there already are perhaps discriminatory policies or practices in place, or awful hate crimes in place, those types of environments naturally are going to correlate more with a higher level of fear or a higher level of anxiety for one's safety. So we want to be mindful of some of those contextual risks that might be present when working with youth and their caregivers. Family members might experience ambivalence and need that support to navigate their own self-exploration to resolve identity conflicts. So now, this is how I saw myself as a parent. This is how I viewed myself as a caregiver. What does that mean? Or does it mean anything as I see myself perhaps of a parent to an LGBTQIA+ youth child? Does that change my own identity as a person or as a caregiver? So not only consideration for the youth's identity, but consideration of the impact on that family member or caregiver's activity. Know that individuals, that caregivers and families may require some time to process the new information. So this ties in really well with that question that was asked, where is somebody in terms of their readiness to change or their readiness to accept? Where are they at in processing this new information that was provided to them? So even if the initial reactions are negative, if they are non-supportive, it might not be indicative of that long-term response or the long-term support that hopefully can be given. So with successful use of motivational interviewing, with successful use of navigating the ambivalence, of providing the support, even if the initial reaction is adverse or is unhelpful, in the long term, we may be able to help align with the caregiver in a way that helps them to be more supportive and understanding of the LGBTQIA+ youth in the long run. So before exploring specifically how MI might be helpful, we want to understand that whole process of self-exploration through which this family members tend to move. So that's where we're directed here for a moment. Go ahead, Rachel. Thank you. So a bit about research. I know some love research, some are like, no, please, no research. But of course, what we present to you today, we want to be empirically supported and just not grounded in opinion or experience. So research suggested that parents and caregivers generally move specifically through 3 stages of self-exploration during their child's coming out process, each dominated by a different processing strategy. So first, we see a large emotional response, movement into a more cognitive and behavioral response, and then spiritual and moral. And I will give equal attention to each of these as we move forward. Thank you, Rachel. So first, that first stage being a stronger emotional self-exploration. During the emotional processing stage, heteronormative and or cisnormative expectations often truly do inform those early reactions of parents or caregivers who find themselves grieving that perceived loss of a normal, quote, of course, normal life for their child. Rachel mentioned worries and concerns of what challenges might be present for an LGBTQIA+ individual or youth, the fears, the community, the contextual responses, the contextual environment that's present. So what does it mean? There's that grieving of a loss of what I thought was, or what I thought is, or what my initial judgment of what somebody should be or is. So grieving that normal life that perhaps they and how they defined it normal, of course, but if defining normal as a heteronormative, cisnormative expectation, there's going to be some grief associated with movement towards losing that view, losing that expectation, and then moving towards what is. So what is the gender identity or sexual identity, and what does that normal look like now? Again, this reaction, this emotional exploration is much stronger when individuals do align heavily with defining normal as heteronormative and cisnormative than perhaps those who have a more fluid definition of what normal might be. So we want to work with them in validating that grief and validating their experience and allowing them to share and process that emotion, but then moving towards that moving through that ambivalence and towards acceptance of what the identity of the individual is. We know as well that this heteronormative or cisnormative, strongly held beliefs or views as normal aren't necessarily consistent with modern science, with advances in reproductive technology, with marriage equality, and with other relevant issues. So we have made great progress. We have made great changes. Normal isn't always what normal was defined as, and many of us know that. And so perhaps even some psychoeducation in the area of, what has changed? What is available? What is normal now? How can we define that? Some caregivers might feel that their parenting is being evaluated or criticized due to their child's sexual identity or gender identity. What did I do wrong? How did this happen? Or perceiving others as judging them. So what did you do to make your child like this? Of course, those aren't views that we hold or we want individuals to hold, but we are very realistic and we know those types of statements are made. And we know that individual clients who come to us share those fears and need to acknowledge them and help them work through that through the emotional self-exploration process. Caregivers might fear that others will perceive the news that they have an LGBTQIA+ child as an indication as their failed parenting or struggles in a family unit. So people making generalizations or assumptions based on simply somebody's gender identity or sexual identity. So that strong emotional self-exploration piece usually being the first stage. Rachel, can you move forward? So as we process the emotion, movement into more of a cognitive and behavioral interaction. So we've acknowledged those intense feelings, we've allowed the experience of those emotions, we've validated the emotions, and then we begin to move forward into the second stage as the individual family members start to process the cognitive aspects of their loved ones coming out. They might engage in self-alienation behaviors to protect themselves or their child from a perceived non-acceptance. So the parent, the caregiver is struggling, and as a response, they're stepping back or they're isolating, inadvertently not providing support, but trying to provide a protective factor as well, so as to perhaps from their perception, not cause further harm to the youth that they love. It's also important to consider whether their family member was outed by others or if it was the self-chosen coming out process, because this truly affects the way the information is received as well as the family's reaction. So did the youth come forth and talk with the caregiver? Did they share? Did they feel comfortable and safe sharing their sexual identity or their gender identity, or did somebody else tell the caregiver? Because that adds another element to the cognitive and behavioral self-exploration. If their loved one comes out privately, for example, the family member might feel more in control of how and when and at what pace they process the information, and how they bring others from the outside in to their immediate family unit. So having the space to be able to work within their immediate family before involving others. However, if their child was outed, family members might struggle with those elements of judgment and how this new information impacts other relations or impacts the context. So for example, I mentioned those communities that aren't as supportive and risks that might be associated in terms of safety or perceptions of safety. So when the child was outed, family members might struggle with processing this new information while also managing those emotions from the first stage, as well as the input of and opinions from outsiders. So a lot of other elements coming into place when somebody was outed to the family members. Rachel, can you move forward? And then that third stage involving moral and spiritual self-exploration. Their religious and spiritual elements often have a strong role and are a theme that we hear about quite often when working with caregivers of LGBTQIA+ youth. During this specific stage of moral and spiritual processing, the caregivers may experience ambivalence related to care and concern for their child and for their loved one, as well as feeling a loss around their child's perceived rejection. Again, perceived rejection of heterosexual or cisgender norms. or even the family's religious values, which might be directly in opposition to LGBTQIA+ lifestyles. Those of us who work very much with this population or have an expertise in this population know that we hear that theme of religion and spirituality quite often throughout the therapeutic process. Specific to research, Rowe reported that some family members identify religious reasons as their non-acceptance. And so as a clinician or therapist, navigating that delicate balance of respecting individuals' religious views while also helping them to accept the gender identity or sexual identity of their loved ones, of the LGBTQIA+ youth. Because sexual identity and gender identity are distinct constructs, family members may struggle with gender norms and additions. So you should be this way, or what does it mean to be this, or what does it mean to be that, and wanting things to fit specifically into one area or to another, and struggling with the fluidity or the understanding. And we see this happening even more so when people do already have strongly held beliefs in an area or within a specific religion about how things should be. So that people say should be this, or it should fit here. Some LGBTQIA+ adults and youth do remain closeted due to fear of negative reactions from friends and family, especially caregivers who may have the strongly held values or morals related to religion, supposed tos or how-tos. And then helping individuals to understand that they likely already do have acquaintances or perhaps know people from the LGBTQIA+ community who might be able to be helpful in supporting them or helping to them to navigate that ambivalence related to, well, my religion says this, but the person I love is this. And look, you do know people already. Perhaps you didn't realize this and how this might be helpful throughout this stage. Rachel, if you can move forward.
So I'm going to talk a little bit about caregiver rejection. There are a couple of questions in the chat that I would like to pause and respond to before we move forward, just so they don't get lost, especially as we move into the case study. An individual mentioned here that a significant challenge they've encountered in their work is situations in which the child's sexual orientation goes against the religious beliefs of the family. We do have some examples in the presentation of how to work with that. I agree. I think in many cases, that is one of the biggest challenges in terms of the family's religious values just conflicting with the child's gender identity or affectional identity. I think that motivational interviewing can be helpful here. And interestingly, when Brandy and I co-authored the article that this presentation is based on, we adopted some strategies for MI being used for spiritual empaths. So individuals that felt conflicted with their religion, we adapted some of that research and that work to fit here. So there are strategies that you can use to help resolve ambivalence and to explore the ability for the individual to hold kind of in their mind the possibility that two things can coexist, and that being that they can hold on to their religious values in a way that is meaningful and important to them, while also continuing to support their child or the child that they're caring for. I will agree that I think it is one of the more difficult situations, but as we move forward, we will share some examples of strategies to at least begin to open up the conversation. Another good question from the chat is, how do you fully support someone who is struggling with accepting their child's sexuality when you yourself have a child who identifies within the LGBTQI+ group and you don't struggle with acceptance without seeming like you don't understand or you're judging their negative view of it? That's a great question. And to be quite honest, the impetus for this article and Brandy and I exploring this research really came from an experience that I had working with someone who I experienced quite a bit of countertransference working with. So it was a parent that I worked with, and they had such a negative and strong reaction to their child coming out that I found myself experiencing countertransference and struggling to determine how I was going to connect with this individual who very clearly needed support themselves and very clearly needed to work through their grieving process in a way where I was not putting my values on the individual, or that I wasn't judging their response to the situation. And so, Brandy mentioned her experience in ethical and legal issues, and that was a very valuable sort of space for me to utilize consultation in terms of how to move forward. And that's where I found motivational interviewing to be very helpful in that situation, and have used it very consistently in those circumstances since then. But I think the easiest answer to that question is sort of a two-part answer. The first being aware of your reaction and being aware of what it feels like for you to listen to someone express these reactions when they have not been your experience, and in fact, your experience has been the opposite. And then the second part is to determine how you can begin to work with the parent in a way that is meeting them where they are in their change process. So how accepting they are, or how they feel about the situation. Where can you meet them, and how can you help move them to the next stage of change? And again, we'll share some examples of what this looks like in clinical practice in just a bit. One last question before we move forward, and that is there ever a time when a caregiver gives too much support or enthusiasm to a young person? Yes, absolutely. It certainly could have the opposite situation in which a parent is so well-meaning that they become over-involved and over-enmeshed in the individual's coming out process, and may want to do too much too soon. I worked with a family a while ago that was really intent on having like a gender reveal party for their child as they were in the process of transitioning to a different gender than the one assigned at birth. And that was not in line with the child's goals. They did not feel comfortable with that. And the family was not hearing that. The family was hearing that, what the family was seeing is, this is a way for us to support, and this is a way for us to get everybody in the family on the same page, and to really show how we are throwing our support behind our child as they express their identity. And the child felt like it was too much, too soon, and it just felt really uncomfortable for them. So great question, and another good example of how motivational interviewing can be helpful on that other end of a spectrum, where someone is so invested in trying to do the right thing that they may not be listening to the process that the child would like to have. And really, the takeaway of today is the child needs to control the coming out process. So while the caregiver supports and the caregiver goes through their own process, the caregiver should not be directing or usurping the child's desires with regard to how they move through that process for themselves. Great questions, and certainly please feel free to keep them coming as we move through the remainder of our presentation. So we talked a little bit about caregiver rejection. We're going to sort of approach it from a different frame, and that is that even once a caregiver has had time to process their loved ones coming out, there's always a risk of rejection. And we add that caution here because while MI can be helpful and while it can work with caregiver ambivalence, it's not a one-size-fits-all approach, and it's certainly not a magic wand. There was, the question about religious beliefs and religious values, and that can absolutely be a barrier that's really difficult, if not possible, for some families to overcome. If you've worked with LGBTQIA+ youth, you've heard the stories, you've heard how their families may reject them, or, may simply just not be able to be part of their journey because of their own belief system. So even with therapy, even with motivational interviewing, there is always a risk that it simply won't be enough to help the caregiver move through their rejection of their child. Rejection can come in many forms. So it could be overly negative, disaffirming behaviors from caregivers. We saw this in the earlier example of the individual that refused to support their child's identification as a non-binary individual. But it can also be more passive non-acceptance or just a general avoidance of the topic. And in my clinical experience, that seems to be the most common form, where parents may deny the existence of, the child's affectional identity. They may avoid using the pronouns that the child has asked them to use, and may continue to revert back to old pronouns or the individual's dead name. And they may do so from a stance of, this is hard for me to remember, or I can't, I've called you this for 13 years. I can't just stop calling you that. Or I'll agree to do it at home, but when we're out in public or when you're around your extended family member, I'm going to refer to you by the pronouns that you don't use, just so everybody, no one's confused. So that passive non-acceptance or that avoidance is certainly something that can be another form of rejection, although it's not overt rejection. That passive rejection can certainly be something that the child has to continue to deal with. Brandy talked about the three stages of processing as a guideline, but like all stages, there's not necessarily a clear stepwise approach through them. It's certainly possible for an individual to experience some element of being able to process what's happening and then revert to an earlier stage. They may get to one stage and just stop there altogether and not really feel like they can move forward, or perhaps they're okay in theory with the idea of their child perhaps identifying as gay, but once the child brings home a partner, they start to experience those feelings again. Or maybe they're okay in theory with their child identifying as non-binary, but when their child begins to make changes to correspond with that gender identity, then the parent experiences a struggle or an issue with it becoming more real. So I say all that to say that there can certainly be a degree of backsliding even when movement has been made. When there is a period of adjustment, the family sort of goes through a process of coming out in the same way that the child is also going through a process of coming out. So redefining family identity, redefining sort of, if we're talking about different names being used, different pronouns from what had been assigned at birth, the learning experience and the coming out process for the family is one that is multifaceted and unique to the particular family. Some families may report that they fear being outed before they're ready for others to know. We see this in particular in small communities or in individuals where there are places where there are tight-knit circles where individuals don't feel comfortable with others knowing information until they're ready to share it. Again, this can be another form of passive rejection on the part of or that the child feels, even if that's not the parent's intention. I've worked with a number of youth who have talked about feeling like their parents are ashamed of them or feeling like their caregivers, keep asking for more time and feeling like that is impacting their own progress and their own coming out journey because they're being made to hold that part of them secret or hide it in a way that feels pretty shameful for them. We've talked about this already, but family members need to process their own experience, and even though their own experience may be steeped in that idea of heteronormative or cisnormative identities, they still need the space to process their emotions, and in some cases, it may represent a grieving process. I've certainly worked with parents of children who identify with a gender different than the one assigned at birth, and the families have experienced a sort of grieving or a loss. Maybe the name that they had assigned to the child was particularly meaningful to them, and letting go of that name feels difficult. Or maybe they had a vision of what it meant to have a son or a daughter, and they have to let go of that and let go of some of the things that they pinned on that vision. So there certainly can be a complex grieving process that occurs for families. One of the things that's important to be mindful of is that that grieving process can also coexist with support and with reimagining the future. So one can sort of simultaneously grieve the loss of an ideal or an expectation and also look forward to what may come in its place and what it may mean to gain a son or daughter, instead of grieving letting go of a son or daughter, or gaining a son or daughter or an individual who identifies as non-binary. And then also individuals understanding of the coming out process can be impacted by their own upbringing. There were some really good discussions in our chat early on related to providing psychoeducation to a caregiver as one of the first steps. And that can be really helpful here to begin to explore what is their understanding of what it means to come out? What is their understanding of what that process looks like? And are they willing to listen to education? And are they willing to, hear from you what they can expect with regard to that process, or hear from their loved one what their loved one wants the coming out process to look like for themselves? We know that parents' ability to process the news of their identity, their child's identity, may differ based on their stage of understanding. They could be likely to cycle back and forth between emotions. Again, a large part of this as well might be dependent on how the parent comes to be aware, whether the child comes out directly to them or whether they are made aware of it in some other way, some inadvertent way. That can certainly factor into how the parent responds to it, how the family responds to it. Higher family resources like cohesion, flexibility, and communication are associated with better levels of family support. So the more trusting, supportive, the better communication within the family, generally the better that the family can adjust and move forward after learning of the child's identity. Some evidence also suggests that families will generally revert to pre-coming out levels of functioning and support, but that is truly dependent on the stressors and the way in which families process the information and the way in which the child perceives support or rejection. So it's not uncommon for families to go back to their pre-coming out functioning, but a large part of that tends to be dependent on the initial reactions and the ongoing support offered by the caregivers. So we're going to transition now into talking about therapeutic application of motivational interviewing for caregivers of LGBTQIA+ youth. So when we adapted motivational interviewing to work with caregivers, we really embraced the goals of the affirmative counseling approach for LGBTQIA+ individuals and their families. The idea here is that collaboration is key, and this approach is grounded in facilitating readiness and motivation to change the ambivalence around the youth's initial disclosure or coming to learn that the youth identifies a gender or sexual identity that the parent was not previously aware of. So the key of this approach is utilizing that affirmative counseling base and utilizing motivational interviewing as a technique to support the affirmative counseling base. If you need a refresher on motivational interviewing, we're going to provide that. As a reminder, it's grounded in change theory. The first step is identifying the individual stage of change. So when we talk about that here, we talk about where the caregiver is in their acceptance and their ability to support their child through the coming out process. So that's the target that we are staging upon initial presentation. Where are they in their own ambivalence around the child's coming out process? And I know we mentioned this at the beginning of the presentation, but this approach is truly for caregivers who are experiencing ambivalence and who are struggling with coming to terms with their child's identity in the way that they learned of it. This is not an approach that is going to be necessary for all caregivers of youth. Some caregivers learn of their child's identity and they're perfectly fine with it, and they're supportive and they're wonderful, and they don't have any adjustment. And so this approach would not be necessary for those individuals. This approach is truly for individuals, caregivers who present in crisis or experiencing adjustment-related stress related to learning that their child either identifies with a sexual orientation that is not in line with what they had believed, gender identity, or both, that is not, where they believed it to be. I'll toss it over to Brandy now, and she is going to provide a quick refresher on motivational interviewing.
Thank you, Rachel. I will try to make this brief, as my assumption is many of you are familiar with MI, and we've talked a bit about the flavor of motivational interviewing throughout today's presentation, specifically to ambivalence. But a reminder that motivational interviewing is a collaborative approach, it's a person-centered approach, and the intention is to guide, to elicit and strengthen one's motivation for change. Rachel mentioned that motivational interviewing is grounded in change theory, and I spoke a bit about that in response to a question, considering where one is in terms of their readiness to change and in terms of their readiness to address ambivalence. So MI is client-centered. MI is directive in the sense that we do provide information, suggestions, and guidance to align and to elicit that change. It is not directive in terms of the traditional interpretation of the word of telling somebody what to do or how to do it. It aims specifically to increase one's internal sense of motivation for change through the resolution of their own ambivalence and then an increased sense of self-efficacy. So ambivalence related to shame or fear or mistrust, whatever it is that emotion is that is tied to the ambivalence and it tied to the processing and understanding, and then transitioning to that perceived sense of self-efficacy. I do have the ability to do this. I do have the strength. I have the motivation. I have the willingness. Rachel. So what do? We want to be mindful of expressing empathy. So that person-centered piece of non-judgmentalism, of unconditional positive regard, of accepting the individual with where they're at. Sure, we may not adhere to, and hopefully we don't adhere to the beliefs of somebody who is unsupportive or has preconceived notions or is struggling with some personal judgment related to LGBTQIA+ youth. We are not suggesting that by any means, but we do empathize for what it feels like to be ambivalent about something, to what it feels like to be fearful about something, or to feel ashamed of something. So we can empathize certainly with what it might feel like to have that discomfort. We develop a discrepancy. So you might think back to sort of that counselor training, social worker training one-on-one, where on one hand there's this, and on the other hand perhaps experiencing this, and what is it like to see that both. So on one hand you really love this person, yet on the other hand your religion says that this is wrong and that it's not okay. You love somebody, on the other hand something, and then working through that discrepancy and what it is to be on one hand this, on the other hand that. Remember, motivational interviewing reminds us to roll with resistance. Oftentimes we use the analogy of boxing. We're certainly not boxing with our client. If we find ourselves in a boxing match or a tug of war, it certainly serves as a reminder for the clinician to step back and consider the resistance that is in play at that moment, and reconsider where the person is that they're working with in terms of their readiness for change and their readiness to address the ambivalence. If there's resistance, that reminds us that this might be an opportunity to realign, to express empathy, to seek understanding, so that we are working as a guide alongside somebody, as opposed to being behind somebody, pushing them along, or in front of them, pulling them along. Motivational interviewing truly embraces that piece of walking beside somebody. Support self-efficacy. So listening for that change talk when somebody starts to demonstrate an interest or a willingness to do something, to try something, to see something different, to truly support that self-efficacy, that belief in oneself. And by all means, avoid argumentation. Again, rolling with the resistance. We can't force somebody to think differently or to do differently and support differently. And we certainly don't want to find ourselves in a debate or in a situation where we're arguing with our client. And there is a lot of passion. There is a strong belief system. There is a lot of advocacy for LGBTQIA+ youth. Certainly all relevant, but we definitely don't want to get into a but this or should this situation with our clients. Rachel? Oh, I see a question. What are your suggestions on accepting while they are staying true to their own religious beliefs? So certainly adhering to our ethical principles of non-judgmentalism, of unconditional positive regard, of respecting one's religious views. And at times, yes, those religious views do not support or embrace LGBTQIA+ populations. They don't support a fluid sexual identity or a non-heteronormative sexual identity. We as clinicians, it is not our role to change somebody's religious beliefs or to change their religious views. It is our role as clinicians to help them with the specific situation that they came to us for. So specifically, we are helping them to become more supportive and understanding of their loved one, to be able to still love them and accept them as who they are. And a large piece of that might be helping an individual work through those belief systems or through those discrepancies. And so, yes, we want to be mindful of their religious beliefs and respectful of them, but we are not meant to endorse them. We are meant to help them come to a place in terms of where they want to believe or where they want to change or how they want to navigate that discrepancy. MI loves its acronyms. So OARS is one that is fluid throughout MI. OARS are essentially those basic skills that we need to use for MI. So asking open-ended questions, not yes or no or rhetorical, opening an invitation for conversation. A is for affirm the person's commitment to their strengths, to their efforts, to their intentions. So if I might even use religious beliefs as an example, I might hear a change talk or hear I grew up and this is my religious belief and I don't want to turn my back on that. I still believe that the Bible says A, B, or C, but I also want to love and accept my child. And so affirming that piece of, yes, you want to love and accept your child. Yes, this is important. Affirming that commitment. Reflect feelings and reflect that change talk component. So when you hear those opportunities, making sure that we don't overlook them. And then summarize the topic areas related to changing so that we can continue to revisit them and to make progress as we align with our client and we move forward. Rachel.
So I'm going to talk a little bit about MI for caregivers of LGBTQIA+ youth, just pulling together everything that we've spoken about so far. The key to kind of what we're going to discuss next is that oftentimes caregivers present for counseling when they're experiencing discomfort, sometimes shame, sometimes anxiety, sometimes fear, grief, some feeling that is uncomfortable to them that they've learned, that they've experienced as a result of their child coming out. So that's the piece that makes MI a really good treatment approach here, in that at that moment, the individual is motivated to not feel whatever discomfort that they're feeling. So they're motivated for change in the sense that they feel uncomfortable and they don't want to feel uncomfortable anymore. Motivational interviewing itself has demonstrated the ability to help family members develop empathy and acceptance by helping them feel more connected to each other. So caregivers of LGBTQIA+ youth are motivated to change and address that ambivalence through recognition and acceptance of their family members' difference. In this case, it may be sexual orientation, it could be gender identity, it could be other areas as well. So we're going to talk before we get to the case study, just one last piece here. Caregivers of LGBTQI+ youth may present to treatment before they're ready fully to begin the change process. And this is common in counseling in general, that most folks may come to us in the pre-contemplation or contemplation stage of change, meaning perhaps they're in counseling, but they haven't really recognized the fact that they need to make a change or express motivation to make that change. So interventions that are really focused on action-oriented, for example, like encouraging the family member to become part of a parent organization that supports LGBTQIA youth, may not be the right time, to introduce at the beginning of that relationship when somebody is still highly ambivalent and experiencing a great deal of concern about the nature of, learning that their child may identify with a different affectional orientation or gender identity. So we're going to practice now on how you can apply motivational interviewing to support the caregiver and resolve ambivalence. And we're going to do that through a case vignette. This case vignette is on Carrie. Carrie is a 42-year-old cisgender heterosexual Caucasian woman who sought counseling for treatment of stress. Carrie and her husband Ryan have 4 children, and Carrie identified that the source of her stress is related to her oldest son's recent disclosure that he is gay. Carrie reported that she was blindsided after discovering a sexually explicit text message conversation between her 17-year-old son Chad and a male peer. So again, what's important here is that Chad did not initially disclose to Carrie. He did not initially come out to Carrie. Rather, Carrie was looking at Chad's text messages and determined that he was engaging in sexually explicit texting with a male peer. So when we talk about how we support Carrie, understanding that is really important as a first step. After discovering the text, Carrie confronted Chad, who then admitted that he was involved in a relationship with a classmate, Chris. Chad stated that he and Chris had been casually dating for about 2 months, but Chad didn't feel ready to share the relationship with his family, in part because he was concerned his family would not accept him as gay. Chad expressed to his mother that he has known he was gay since about age 8, but stated that he had only recently come out to a few friends after beginning his relationship with Chris. During the counseling session, Carrie expressed to the counselor shock, dismay, and anxiety about how to support her son, how to share this news with her husband, and what this might mean for the family's identity in their community and at church. So, really, a few key points that we've already spoken about, and that is Carrie experiencing ambivalence with regard to wanting to provide a supportive presence for her son, but then also feeling torn by her role as a wife, as a community member, as a churchgoer, and not necessarily knowing what her son's identity might mean for all of those things. So, to lead us into our discussion, we're going to talk a little bit about the initial treatment process and pull out a few key elements here. So during that initial session, we see that discomfort. We see the reason Carrie came into counseling. It's because she was reporting stress, but truly it was that discomfort and wanting to get what she reported her son back on track. So her idea was that if she may be able to come in counseling, she may be able to help her son get back on track. That was sort of what she was hoping she might accomplish, even though it's likely a part of her realized that that was not necessarily a realistic goal. Her feelings during that initial stage with wanting this all to go away, with wanting things to go back to the way she thought they were, are pretty in line with typical heteronormative expectations that some caregivers, not all, but some can project onto LGBTQIA+ youth during that initial emotional processing stage. So the counselor here would then recognize that Carrie's ongoing desire to help Chad return to what she believed would be heterosexual normality could have a negative relationship on or negative impact on her relationship with her son, as well as both of their mental and emotional health. The key here, and it speaks to some of what we had talked about earlier, is that in order to be productive with Carrie moving forward, you need to develop a strong working alliance with her. And this is a piece that can be difficult. I mentioned my own countertransference in situations like this. It can be difficult, especially if you're the parent of, an LGBTQIA+ child, or you're a parent in general, or you're in the LGBTQIA+ community yourself, or you have a loved one who is. We all bring things into the counseling process. And if you've had experiences, it can certainly be difficult to suspend those and to provide to Carrie the empathy and support that she needs in order to be able to process these feelings. But it is important that you develop that strong working alliance. We know, regardless of presenting concern, regardless of theoretical orientation, that truly the therapeutic relationship is the most important aspect of the therapeutic process. So developing that strong therapeutic alliance is really important here. And to go back to what we talked about earlier when we talked about the case of Jay, reinforcing the idea of listening and validating becomes really important. I'm going to move on here. So our first chat in, and you can just feel free to drop your response in the box. Carrie stated, I just kind of believe this is a phase. This is something we hear a lot from parents. We heard it in the earlier introduction. I think it's just something kids do now, It's in to be gay or bisexual or transsexual or whatever the new sexual thing is. I think Chad just needs to meet the right girl and he'll forget all about this gay stuff. So if you are working with Carrie and she stated that to you, how might you respond to build empathy with her? Just take maybe 1 or 2 minutes. You don't have to perfectly type it out, but what might you be able to say to help facilitate a conversation around empathy that was steeped in empathy, but around this topic? So, those of you that work with LGBTQIA+ youth, that's not a phase, that it's not as simple as meeting somebody of the opposite gender. But how would you meet Carrie where she was in her change process and build empathy in order to be able to continue to move forward with her? Let's see here. So this is a great one. Love this. It is, Rebecca shared that it really sounds to me like seeing that text was very shocking. That's a great way to build empathy and to move Carrie away from this idea of changing her son's identity and speaking about her own emotions. Rebecca really nailed it with one sentence. That's a great way to begin to open up conversation and to really get this conversation, this therapeutic conversation, where it needs to go. And that's on Carrie's feelings. That's on what it was like as a mom, as a parent, to stumble upon this information and to not know how to respond to it. What was that experience like for you? That's a great sentence. It's a great statement and a great way to empathize with her, validate her, but then also move her away from this idea of changing Chad's sexual identity. I can see this is really hard for you, is what Sharon said. Another great example, another great open-ended question that validates her emotion, reflects her feeling, and brings her to this place of talking about her own emotions. Tessa shared, you really care about your son, you want to be the right way to him. Great, really great opportunity here to begin to have that conversation about her love for her son. That'll really come in handy later as we work on building up some of those discrepancies. There are so many good ones in the chat, and I'm mindful of time. I'm just going to read one more. I love this one. It must be hard for you to see your child differently than you did when you awoke this morning. Fantastic. Really plays into that idea that she's likely grieving, that this is something that she has learned that she wasn't prepared to learn. And so she's likely experiencing some level of grief right now. Fantastic. There are so many good ones. I want to read all of these out loud, but I want to move forward so we can kind of move through the rest of the presentation. Carrie described her emotions as disgusted and horrified to learn that her son was gay. So really strong feelings. The counselor then would use MI to validate her feelings. You had a strong reaction to the news. So we saw these examples in the chat as well. And to begin to develop an opportunity for change talk. You really felt surprised and knocked for a loop by the announcement that Chad made. So these types of reflective statements really provide an opportunity to help Carrie move to contemplation. So she's probably pretty pre-contemplative right now, but to begin to move to contemplation and begin to objectively explore the situation at hand. Again, what's key here is keeping the emphasis on Carrie's feelings. And so as a result of the conversation, what the counselor may come to learn is that Carrie would likely have these concerns regardless of who she discovered her son was exploring sexually explicit contact with. So even if it was a heterosexual, even if Chad had been talking to a girl, it's still a lot to take in as a parent that your child is of this age where he's beginning to explore sexual conversations with someone. So focusing on that as well could be real helpful here, and focusing on, regardless of whether or not you've learned your son is gay, you've also learned that your son is approaching adulthood. And as a parent, that reflects a lot of lack of control that you may be experiencing in this moment. I'm going to toss it back to Brandy. She'll do the next chat in and bring us home with this presentation.
Thank you, Rachel. I appreciate it. I love the chat in. This is amazing. All right, Carrie states, I can't even begin to think about telling my husband that Chad is gay. He will disown him. I'm sure of it. It's not something he will understand. How would you respond to validate her feelings and opportunity for change talk? I'm hopeful that there's typing. I jinx us with the energy. Great. All right. So Sally said, can you tell me about how that possibility makes you feel? Love that. Empathizing, aligning, asking for more information, the opportunity to validate the emotions. Paula, I can definitely understand your fear. Patricia, that must scare you. All of the reflection of emotion here in terms of what Carrie is sharing that she's experiencing. It's moving on me. Tamalyn said, related to her experience of finding out and her goal of supporting her son. So tying in those pieces of information. Jessica, it may be tough to navigate these new family dynamics. Let's figure out a way to bring it up together. So that guide on the side, aligning with the client, helping Carrie to know that she is supported and validating her emotions in this process. Christina, it sounds like understanding of your son by your husband is important to you. Again, more affirmation and validating. I love these. I love the participation. I love the motivation of this group to employ motivational interviewing. All right, a few more seconds here. So Rachel, do you want to move forward so I make sure I leave a little room for Q&A at the end? So when we're building discrepancies, as in the case of Carrie, she continued to elaborate on her thoughts and feelings. And a lot of the chat suggested that we allow her to continue to do that to help her validate her feeling to express them. The counselor then provided some opportunities to highlight the discrepancies between her initial strong negative reaction toward the idea of Chad living as a gay man and her increased understanding that by failing to be true to his sexual identity, he may have further distress and turmoil. So I mentioned the use of on one hand this, and on the other hand that, when I first introduced discrepancy. So an example that we might use here if working with Carrie would be to say, on one hand, you don't want life to be any harder for him by being part of a minority group. Yet, on the other hand, you recognize that it will likely be difficult for him to live a life in which he didn't feel that he was being his true self. When these discrepancies are carefully developed by using MI skills, they do provide an opportunity for a client to start using change talk. And when we really hear those opportunities for change talks, we want to hone in on them, we want to grab them, we want to use them to help move towards that piece. And in this case, that what it might be like or how difficult it might be like to live a life of not being true to self, helping the person, the individual, in this case, Carrie, to become more supportive. Rachel. So we may have to skip this chat-in because I realize we only have 4 minutes remaining, but we would want to continue to highlight discrepancies. So in the example here, Carrie states, at the end of the day, I love my son and just want him to have every opportunity available to him. So we really start to hear how much she loves her son, how much she appreciates and wants his well-being. So if you want to move forward, Rachel, I'll talk us through this, but do feel free to chat in responses to share with each other if you'd like to do that. So Carrie really began opening up even more here and discussing her fears and concerns for the family as a whole, specifically related to that piece about how Chad might be treated by the church or by religious beliefs, but moving on to talk as well about how she cared about his well-being and her love for her child being of really what's at the root and what's important to her. So MI skills of reflection and discrepancy building can help Clary explore that conflicting nature of some of her statements. So for example, to some extent, it feels that your son coming out as gay is a reflection of your parenting ability. So on one hand, I heard you mention a moment ago that you want what's best for him. Yet now I'm hearing that your hope is that you may be able to stop him from living a life as a gay man. And so focusing on the discrepancies, on the different things that are contrasting each other that Carrie is sharing with you. So next steps with Carrie. So as we move forward to working with Carrie, or perhaps you've worked with Carries in your own real life practice, the therapist continues to help her explore her reactions and underscore ways in which she can begin to practice acceptance around her son's coming out while simultaneously addressing her feelings of grief surrounding the loss of her previously held view of Chad and his identity, and her future vision or vision of what Chad's life would be like, to embracing his current identity and the future that Chad intends to build or create for himself. This process of exploring ambivalence will increase openness to honest self-exploration for Carrie, and we will gradually start to see a resolution of that interpersonal conflict, so a decrease in the discrepancies. As we move forward in future sessions, we might also focus on involving other sources of support, perhaps family, friends, to assist her in accepting her son. So a brief summary, perhaps very brief, is that family members of LGBTQIA youth might use counseling as an opportunity to seek support for themselves, to seek greater understanding of their child's gender and sexual identity, to seek a way to become more supportive, to align with their child or with the youth for whom they care and love. It's important for these families of LGBTQIA youth plus youth to have their own space to process their emotions, to allow themselves to feel their emotions and to feel validated in their emotions. So MI offers the therapist and the clients to explore the reasons that an LGBTQIA youth caregiver is motivated to change. As we hear, that motivation to change is often grounded heavily in love for the youth, care for their well-being, wanting to be supportive, and finding the motivation to change within that. MI lends itself well to working with clients in the pre-contemplative and contemplative stage of changes. So those who are not necessarily ready to change, but allows us to bring them to a place to align with them and meet them with where they're at. So family members who are resistant, who are ambivalent, MI offers us an opportunity and a way to work with them. Thank you. Our resources and some upcoming events that are being offered to all of you. So thank you from Rachel and us for your time today.
Yeah, no, thank you so much. I do recognize that we are at time. Thank you, Dr. O'Neill, Dr. Dia, for a very informative and interesting presentation on this topic that certainly needs much more work. So I do want to remind folks that the slides for this part 1 and part 2 will be, part 1 should actually already be on the website, but the slides and the recording for this particular webinar will be up on our website within the next 2 to 3 days. As you see listed here, we do have some upcoming events, so I certainly invite you to join us for those. I know we didn't get a chance to do Q&A, but I just want to list your emails if possible. If anyone has any additional questions, please send them to us and we can certainly forward them to our presenters, or if you want to directly email our presenters, and if that's okay with you both, here are their emails. And once again, just on behalf of our presenters today, on behalf of the CTAC team, we do want to thank you for joining us. You will be receiving a feedback. We encourage you to fill it out, as these webinars actually came from your feedback. We do pay attention to them, so please take the time to fill them out. They are very short. And again, on behalf of everyone here at CTAC, our presenters, thank you so much for joining us, and have a good rest of the day, everyone. Bye-bye.